On Friday, I saw the surgeon who may be able to fix my arm. Because back when I had the accident, we thought that all that blood where I had basically severed my arm at the elbow was going to be the major issue. We didn't realize it was actually going to be in my shoulder. Because while this is largely healed up, and I actually have use of my hand and my forearm, I still don't have any use of my shoulder or my bicep. So basically, I can't lift my arm. If I put it up there, I can type, I can do other things, but I can't really do anything as far as lifting it. And they didn't know any of this until I went back to get the sutures out of my elbow, because first of all, they told me not to use the bicep because they'd had to surgically reattach it. And second of all, they said, hey, if you're facing any issues, you went through a really bad accident, there's going to be a lot of trauma, don't push yourself. So it was only when I went back and I had basically complete atrophy of the supraspinatus or something, a muscle on the back of my shoulder and on my deltoid, they were like, hey, this doesn't make sense. Like, you should have gotten some activation. Then I went to get an EMG, where first they do the shock test, or they push electricity through your nerves to see what works, and then they stick a needle down in your nerve and tell you to contract the muscle, and they test whether there's a signal or not. Then 2 weeks ago, I had an MRI of my spine and my shoulder, and this is what they're trying to figure out. There are two possibilities. It's possible that I have an avulsion, or basically a complete avulsion, where the nerve was literally ripped out of the spinal cord and they would have to do spinal surgery to reattach it. The other possibility is that somewhere down the line, somewhere along the path from the spine to the muscle, there's a tear or a rip or a pull or something, and they're trying to figure out which of those is most likely. And the most recent idea is that there's a partial avulsion. Essentially, it's partially pulled out of the spine, but they don't think that I'm going to need surgery there. They think it'll heal over time. It's going to take time. It's going to be a pain, but they do think they need to do a nerve transfer further on down the line, where they basically take nerves for one thing and apply them to something else. And I have to go back in a few weeks for a follow-up EMG where they're going to do the shock test, and then they're going to do nerve test again and see if there's been any improvement. Like, has anything grown back? Has anything grown stronger? Where I'm at today, then I go about a week after that for a follow-up, and they're going to schedule the surgery. The problem is that even if they do the nerve transfer, even if they try to fix the avulsion, it's not like it just switches back on. It's not like it magically starts working. They said it may be a year or 2 years before I get function back, and they don't know whether it's going to be 10% function or 90% function. But even with 1.5 arms, I'm still doing things. I've done a pretty decent job so far renovating this condo, so I'm just going to keep doing what I can with what I've got, and I hope that what I've got increases, but if it doesn't, I'm still going to make the best of it.